Hey, good morning, church. My name is Daphne Ochoki, and I'm part of the health ministry. And by the suggestion of Effie, I'm able to bring to you breast cancer awareness. Since it's October, it's good for us to have a discussion on this. So, what is breast cancer? Breast cancer begins when abnormal cells grow in the breast ducts or lobules, and they can spread to other parts of the body if not identified early and can be metastasis cancer. So as Christian, we have to look at it at the Christian eye. What do we believe? We believe that God is the ultimate healer, okay? According to Psalm 103, 2 to 3, and that he heals through both miracles and uses medicine as well in James 5:14 to 15. So treatments may include surgery, chemotherapy, radiation, hormonal therapy, or targeted therapy. Faith and medications or medicine works together because while doctors treat the body, prayer brings peace, strength, and hope, according to Philippians 4:6 to 7. So breast cancer is one of the most common cancers among women worldwide. About 13% are affected. That equivalents to 1 of 8 women will be diagnosed with cancer or of cancer. So it's very important for us to look into early detection and awareness because this will significantly improve one's survival rates if caught early. Also, men can develop breast cancer, and though it is very rare in men, it's about 1% compared to that of women. So under risk factors, it's very important to ask for family history of breast cancer. You can ask your mom, your grandma, and see if there's anyone who has ever had breast cancer. Also, there's genes, which are genetic mutations of BRCA1 and BRCA2. This is by the provider will be able to let you know. Also, the age of onset, after age 40, it increases with the highest rates being between 50 to 70 years old. Also, early menstruation or late menopause could be a sign, not a classical one, but could be a sign as well. Also have obesity and poor diet has been linked to increasing the risk of breast cancer. Alcohol consumption is a big one too. That changes the genome in our systems and can cause breast cancer as well. If somebody works under radiation departments, x-rays and all of that, or somebody has had multiple x-rays, it's very important to be aware that this can be a huge risk factor as well and can cause breast cancer. Under preventative measures, so it's important to do regular breast exams, self-exams on yourself while in the shower. You raise your arm up and you massage in a circular motion, just like the picture. And once you're done, you do the other arm. And then also doing routine mammograms as recommended by your healthcare provider. We also have to maintain a healthy weight and diet, eat healthy, limit alcohol, don't drink at all. Also stay physically active, doing aerobics, avoiding smoking, and also discuss genetic testing if you are high risk, if you know that your family had a history, have your provider look into the genetic testing. It's very important. Early stage breast cancer is highly treatable. So knowing the signs, and how do we know the signs? Is by doing the daily self-exam, in the shower, and noting if there's any lumps, if there's immovable lumps, specifically immovable. We do have some lumps that could be movable, and it might not necessarily indicate it to be cancer. But if you feel something that's rigid is not moving, that could be a sign that you do need to get checked out for breast cancer. Skin changes, discolorations in different parts of the body is another sign. And also like nipple discharge or deviation of nipple, if they're starting to look different directions and point in different directions, also another classical sign. So it's very important to schedule annual screenings and checkups with your provider, and they can advise you forward. It's also very important to keep spreading awareness or being aware. This saves lives, and also please encourage other people to get screened, because lack of education can also, or lack of awareness can be a big risk factor. Again, on this slide, we're going to be honing on the importance of spreading awareness. It definitely starts with us. It starts here in the church. It starts out there. If you know something, say something. If you hear a friend say, oh, they're having this symptom and you have heard of this, you can say, please look into this. Just explore further on this. Look up or ask your provider about this. It's very important to spread awareness and support those who are affected. It's very important to support them, and also taking preventative action as we have discussed. So together, me, myself, God, and the entire church community can help bring a difference and change. Thank you all. Appreciate it.